Today, we're going to be talking to Dr. Zoe Webb, a qualified clinical psychologist, about the qualification and skills and experience you need to be a clinical psychologist.
So my name is Dr. Zoe Webb. I am a clinical psychologist. I currently work in independent practice, but I worked within the NHS for about 10 years prior to opening my own practice.
What is a clinical psychologist? What do you do?
So a clinical psychologist is otherwise known as a scientist practitioner, and that means that they use the science of psychology and apply that to their clinical practice. They may work with individuals who have got a range of mental health difficulties, emotional difficulties, or maybe physical health problems that have implications on their mental health. And they use a process of assessment, formulation, treatment or intervention, and then evaluation in order to support those people with their mental health and emotional well-being.
How do you train to be a clinical psychologist?
So in the UK, the route to becoming a qualified clinical psychologist starts with gaining an undergraduate degree in psychology or some kind of conversion course. After that, typically, you'll need to get a number of years' worth of experience under your belt, which could be through voluntary work, could be through working in different healthcare settings, as an assistant psychologist or as a research assistant. Those are the kinds of things that would give you the relevant experience to then obtain a place on a doctorate programme. These are very competitive places, so the more experience you can get, the better. And ideally, if you can get work with a clinical psychologist, that would stand you in good stead. Once you get onto the doctorate training, that is a 3-year doctorate programme, and that includes a combination of teaching, work placements, research projects, essays, that kind of thing. Ends with a dissertation, and then once you come to the end of that, you are a qualified clinical psychologist.
What attributes do you think you need to be a clinical psychologist?
I think you first and foremost need to be interested in people and interested in the mental health of people. I think you need to be a good communicator with those individuals, but also with the networks around those individuals, because you're often working with them as well. I think you need to be empathic, you need to be a good listener. You need to be accepting and non-judgmental of them, so they may hold different beliefs or views to yourself, but actually you need to show them that you're accepting of that and understanding of that. And I think you need to be understanding of the idea that change can happen in very small steps, if at all, and that sometimes we can't always help everybody. But I think they're the things you'd need to be a good psychologist.
Do you have to pay for your training?
So you don't have to pay for your training. You're essentially employed by the NHS to do your training. So you actually earn a salary of around £28,000 a year for the 3 years that you complete your doctorate.
What is the difference between a psychiatrist and a clinical psychologist?
So a psychiatrist and a psychologist may well work within the same clinical settings with the same clinical populations, but the main difference is that a psychiatrist is trained in medicine and in a medical model. So they are much more involved in diagnosing and medicating for clinical problems. Whereas for a psychologist, we deal in what we call formulation, which is more about developing a hypothesis, a working idea of what somebody's difficulties are, and then thinking about a treatment plan that's more likely to involve a therapeutic intervention instead of, or maybe as well as, medication.
What is the difference between a counsellor and a clinical psychologist?
So the main difference is in their training, so they would have different training routes, and I guess historically clinical psychologists have probably worked with more complex, more severe and enduring mental health difficulties than a counsellor would. Probably more recently the gap between the two has become less, but there's still differences in the way that they practice and the therapies that they would use.
What are the different specialties in clinical psychology?
So once you're a qualified clinical psychologist, you can work in a range of different settings. So that might be working in child and adolescent mental health services, in adult mental health services, or what's referred to as older adult mental health services, or you may work in a service that's designed to support individuals with learning difficulties. There are also other specialist services that might include things like forensic settings, or specialisms within any of those other services that I mentioned. So for myself, for example, I work with children who are looked after or who are in the care system or who are adopted. So that's a specialist area within child and adolescent mental health, for example.
Where does a clinical psychologist work?
So the majority of clinical psychologists, again after qualification, work within NHS settings. So that could be within a clinic setting, a hospital, or as I mentioned before, you may be in a forensic setting or somewhere more specialist. Other psychologists like myself choose to move out of the NHS and into independent practice, and that's perhaps something that's becoming more common within the world of clinical psychology. But there are essentially the two options of working for the NHS or working independently in practice.
Thanks so much for coming today, Zoe, and taking the time out of your busy schedule.
It's an absolute pleasure, and good luck to anyone out there thinking of going into the world of clinical psychology. It's a very rewarding and enjoyable career path to take.